on. 1, 2, 3. Awesome. Okay.
Go ahead.
We're just applying the topical numbing cream. We're going to do the Morpheus8 of the neck and face. And then we're going to add a nice little brightening chemical peel to really tighten and brighten the skin.
Yeah.
How great did it feel once everything peeled off?
Oh my god, it didn't peel off that much though.
Oh really?
No, I didn't.
A little dustiness, or
it was just like dusty. It was weird because
you've done the bigger ones where it's really peely.
Yeah.
Yeah. No.
How come this didn't peel that much?
Morpheus8 penetrates to a deeper tissue, so it actually has silicone-coated needles to protect the epidermis. So you're going to get that light flaking, and then with the chemical peel, you're going to get that light flaking, but it's more of a deeper resurfacing and tightening.
So all my girlfriends are getting facelifts, every single one,
Mm-hmm.
and so. When's the typical age to get a facelift?
I think it depends on genetics, skin quality, things like that. Obviously not a surgeon, but the trend has been after 45. 45 to 65 is kind of like the sweet range.
Okay.
That people end up doing it. Facelifts don't help wrinkles. Facelifts help tighten the tissue and that loose skin where you can pull it, or the loose lower neck skin. What skin resurfacing does, it couples really nicely synergistically with a facelift because you get that tightening aspect, and then you kind of get an ironing or resurfacing with the laser resurfacing.
Okay. So what do you recommend for like a 20-year-old to do? Just stay out of the sun and put vitamin C?
Oh my gosh. Stay out of the sun, wear hats, sunblock every 90 minutes at least because you're going to sweat it out, it's going to wash off, and just really be avid, especially when you're driving.
Yeah,
Make sure that
that's why I have these.
Well, not anymore.
I know, but yeah, when I'm driving, I had melasma, but that chemical peel got it off, and
Yes.
the hydroquinone
Yes.
got it off,
Yes, and retinol.
and retinol.
We love our retinol. Yeah, so at this point, I mean, you're right now in this maintenance stage. You don't need a facelift. Your skin's not loose. You've protected it and been treating it for years, knowing that as we age, we lose collagen. Collagen starts decaying and bringing down the skin and losing its elasticity.
So do you think that red light really helps?
I think it really suppresses the inflammation and it helps kind of promote the healing process. Your jawline, literally, that little nodule that you had is completely gone. It's so smooth and straight now.
Because you took it off!
That's awesome.
Yeah, your jawline looks really good.
Right?
This doesn't hurt.
Good. So this is that lighter setting. It's only a 2 millimeter. It's for more superficial tissue, so that's why we can go on the full face, neck, everywhere with it. And then I'm gonna increase it for the lower face one more time, okay?
Yes, that's fine.
I haven't missed anything. We're not done yet.
Right here.
I haven't done it yet.
Holy smokes.
How you doing, babe?
Good.
Yeah, really?
Well, she said I used to have them. And, like,
You don't have them anymore.
It's a mind. It's like a Marine. You know, you have to.
PTSD?
No, you just have to like overcome. Like, it's
Yeah.
mind. It's like mind over matter.
Yeah.
So right now I'm going to wipe off her face with all the dry blood because we obviously don't want that just sitting there. It's not a cute look. And then we're going to put the chemical peel on top for the brightening. So this is just saline to remove all the dry blood spots. And then I'm going to put some blackout goggles on you and we're going to resurface the under eye really gently to try to tighten. So if you can see underneath Kelly's eyes, there's just some really superficial fine lines and wrinkles, just normal under eye appearance, but with the laser resurfacing, either erbium or CO2, you can actually tighten the skin because you're removing tissue, therefore stimulating new tissue to come in, therefore making it nice and tight. Don't move your face from me, okay? Especially your under eyes. If you can get the buffalo filter, you grab that, just don't get too close. Because we'll suck the goggles. 1, 2, 3. Beautiful. So if you've ever seen the plasma pen, it's very similar to that, where it's literally just taking out little microchannels of tissue, but this one's a lot faster. Plasma pens, I think estheticians can do it, which is why it's become so popular. But if you can get to a facility that has a laser nurse or doctor that specializes in it, you can get the best results doing this.
How you doing?
The cold air helps. Thank you so much.
What is this you're doing now?
This is the chemical peel. It's a brightening peel because she has melasma, so I like using this after resurfacing for her. And for any of our darker patients to really help brighten the tissue and not have any residual risk of pigmentation. Although we do want you to continue using hydroquinone after treatments like this, just to really prevent any post-inflammatory hyperpigmentation. But overall, this just kind of is a nice little added bonus for brightening.
Was the second treatment the same as the first? You do more or less the second time?
Second treatment, as far as the settings go, are exactly the same. As far as pulses go, exactly the same. We are trying to target the loose skin, so we continue to do the same treatment to really retract that back. This one was a little different because we added the erbium for the under eyes to tighten up that tissue. Because the Morpheus8 gets a little bit under there, but it doesn't do resurfacing superficially. It only goes deep down to tighten what loose skin has.
And she has one more treatment?
Correct.
And then what?
And then it's just maintenance. Whenever she feels like her skin's kind of losing its oomph, we go ahead and treat it again.
But how long is this good for?
This is permanent results. So as long as you're taking care of your skin and you're out of the sun and you're making sure that you're using your sunblock and protecting it, it's permanent.